Hi, good evening. I'm Dr. Kayan Siodia. I'm a consultant interventional cardiologist at Raheja Hospital. And today I'm going to just be touching on a topic which is affecting us in the long run, especially young individuals. So there's a series of lectures, and first and foremost, which many people I'm seeing nowadays come with, are young hypertensives. There are repeatedly, I get questions keep asking me, what should we do to prevent hypertension? How should we control it? And what is hypertension per se? Is it the same for older individuals? Is it the same for younger individuals? And how we should take care of it? So, first to start with, what is hypertension? So, hypertension is actually the blood pressure in the force. So, your heart contracts, it pushes out blood, and that is the force of the blood that is exerted on the arteries. So, the more the forceful the contraction of the heart, the more is the force with which the blood travels. That is what is measured actually. And it is actually a medical term for high blood pressure, hypertension. And it is the increase in the amount of force that the blood places on blood vessels as it moves throughout the body. Now, what is it a sign of? So it is actually a sign that the heart and the blood vessels are being overworked. So a body is used to a pressure of 120 by 80. So if the heart contracts more, the blood flows with more pressure. And this actually shows that the heart and the blood vessels are being overworked. Untreated, this disease can lead to atherosclerosis, that is plaque formation in the vessels in the entire body, including the vessels which supply blood to the heart. So very interesting thing is that the entire body receives blood when the heart is contracting, but the heart itself receives blood supply when the heart is relaxed. So this is a very beautiful thing, and that is what actually in details I'll speak about later. So what exactly defines blood pressure? Anything more than 130 systolic, that is the upper, and anything more than 80 lower defines blood pressure. So anything above is called systolic, the below number is called as diastolic. And that is the amount of force that is exerted throughout the body. Causes of hypertension. So I would rather divide them into modifiable and non-modifiable. So non-modifiable would be something like genetics, something which you're born with. You're genetically predisposed to have a higher blood pressure. Sometimes you're genetically predisposed to have even higher cholesterol. Aging, non-modifiable. Stress, I actually have put stress into non-modifiable risk factors rather than modifiable risk factors, which it was in previous times. Modifiable include obesity, that is your weight, smoking, high salt intake, high alcohol consumption, and lack of exercise. Most important is lack of exercise. And all this which I spoke on actually presets a terminology called essential hypertension or primary hypertension, where actually you do not, there is no cause per se. Then there are other causes which can lead to hypertension, which is obstructive sleep apnea. So snoring, when you see a person snore, it actually proves that the tongue is falling behind. When a person is well built, the tongue falls behind, obstructs the airway, and that's why snoring happens. So snoring is a predisposition to hypertension, and the medical terminology for that is obstructive sleep apnea. There are other heart defects, not going into much details about that. Then kidney diseases, yes, very underdiagnosed, but I feel that kidney diseases to a great extent leads to hypertension. Medication and illicit drug use, and most important is smoking. So that actually is a very, very big modifiable risk factors. So time and again, guidelines are presetted to us. The last was the JNC 8, which says that the ideal blood pressure should be less than 120 by 80. That is called the optimal. The normal blood pressure should be 130 by 90, and anything above that is staged. So 160 by 100 is stage 1, more than 160 by 100 is stage 2, and stage 3 is more than 180 by 110. So what are the symptoms which generally we present with? So in younger individuals, they will generally present with chest discomfort, non-radiating. You may think it's a cardiac issue, but it's just the blood pressure would be on the higher side. There'll be severe headache. Nowadays, screen time is a lot. So eye pain, orbital pain, which is termed. You might have difficulty in breathing. And older individuals generally present with fatigue, uh, blood in urine, and same symptoms which I've stated for younger individuals. But nowadays, we see a lot of young individuals having hypertension. And most importantly, it is the quality of life that actually has changed the entire thing. The complications of hypertension can be in myriad, which is starting from the top. So it actually, when you have, I see patients coming with systolic of 180, 200, they come with strokes, dementia. Then there can be hearing loss or tinnitus, that is the ringing sensation in your ears. Then there can be visual blurring, complete loss of vision in some. Some people come with heart attacks, enlarged hearts, and there can be scarring of the kidneys, kidney dysfunction. So as you have noted, that anything from top to bottom, all organs get affected. And by the time the symptoms come, the hypertension has been there for a long time. So I always take a young hypertension to be the tip of the iceberg. So only 1/10 of individuals with hypertension actually get diagnosed. The 9/10 are still below the water, which are undiagnosed, which is very scary, because later, by the time they present with symptoms, end organ damage has already occurred. The question which keeps popping up is, how can I prevent hypertension? The answer to which is known by all, followed by none. So I always keep saying this, So eat healthy, exercise, lose weight, limit your salt intake. I'll come back to the salt intake. And stop smoking, reduce alcohol consumption. Very specific, alcohol consumption, anything more than 3 units, that is 30 ml thrice a week, is more than that is required. And binge drinking itself is a harbinger of hypertension. Lifestyle intervention in the form of weight loss, dietary approaches, sodium reduction. Now that's your salt intake. Now, as per the guidelines, I'll actually give you data of Indian communities which prove that Indians take anywhere between 12 to 20 grams of salt per day, which is phenomenally huge. The guidelines actually have told us that anything between 2 to 4 grams of salt is what is required. So it is noted that 2 to 4 grams, all your food becomes insipid, since nobody is able to follow it. But everything in moderation is good enough. Exercises, 30 minutes of aerobic exercises on most of the days, that is 5 days a week, is something that you will be looking at, because this actually is shown to have a reduction in blood pressure, prevents new onset of hypertension, and if you have hypertension, it prevents end organ damages. Coming to the diet, very important. So I'm just going to give you a brief history. So they did a large survey and found that Europeans, especially the Western Europe, France, Spain, that side, they found that people, though eat a lot of meat there, they found that the prevalence of hypertension is very low. So they dwelled into the diet of these individuals and found something very, very significant. And that's why it's called the DASH diet, which they follow. Very rich in fruits and vegetables, 4 to 5 servings of fruits per day, vegetables 4 to 5 servings, 6 to 8 grams of whole grains, which is a lot. Nuts, seeds, and legumes are a lot. They follow a continental diet, so the salt and added sugars are kept to the bare minimum, and fats and oils are also to the minimum. So this was found actually the reason why they had less blood pressure issues. And they also found that their diet was rich in apricots, raisins, mangoes, and cranberries, which are known to actually dilate the vessels and keep the blood pressure under check. So the eating plan should be actually, if you follow a DASH diet, it is not going to be very, very difficult, for the simple reason it doesn't stop you from eating anything. It actually just adds insight into how to eat healthy, and that is what is important. Weight loss is actually very, very important because it is one of the most effective lifestyle changes for controlling blood pressure. If you're overweight or have obesity, losing even a small amount of weight can help reduce blood pressure. And in general, blood pressure might go down by 1 millimeter of mercury with each kilogram of body weight that is lost. So that is very, very important. So the leaner you are, the better it gets. Exercise. Time and again, I've been asked about exercise, how to go on with it. Regular physical exercise can lower blood pressure by 5 to 8 millimeters of mercury. And it's important to keep exercising to keep blood pressure from rising again. So you cannot start a regimen and then completely take 2 weeks off and then start it again, because your body has to get used to that metabolism. That is very important. The corollary to that is, I've seen individuals who get this real urge to exercise going directly for heavy weightlifting, heavy exercises. Remember, your body is not used to it. So you'll hear about people just dying of heart attacks in gyms and all. It is because of this reason. Your body has to slowly get acclimatized to such strenuous modes of exercise. So start slow and build up gradually. That is the essence. And cut the salt out as much as you can. That means I cannot overemphasize on it. So whatever is palatable is good enough. Don't add extra salt to it. Don't add salt on top. So that is very, very important. And the less the salt you take, the more the chances of you of not getting blood pressure is good. So it is a combination of your diet, your entire lifestyle modification, which everybody knows about, but as you said, hardly is being followed. Sleep is very, very, very important. It is not only the number of hours of sleep, but there is a new terminology which has come into medical science called sleep hygiene, which actually believes in a fact that sleep is so essential to the human body that unregulated sleep can lead to a multitude of diseases which are being proven, and as we speak, these trials are ongoing. So getting fewer than 6 hours of sleep is called poor sleep quality, but that is only for adults between the second to the sixth decade, that's 20 to 60 years, and that can contribute a great deal to hypertension. A number of issues can disrupt sleep, including sleep apnea, which I spoke about, the snoring. So when you snore, you don't realize, but as I said, the tongue falls back, air intake goes down, your oxygen level goes down, so your brain gets up. So your brain doesn't get, so there is awake pattern which is seen in your brain. Once this awake pattern is seen in your brain, even though you are sleeping, the brain has got up. So it'll release hormones like adrenaline and all, which will again go into a metabolic phase of your body, which will increase your blood pressure. So prevention of that would be, depends on how your sleep cycle is. Your weight loss is the most essential for obstructive sleep apnea, and stick to a sleep schedule. Don't one day sleep at 9 p.m. and the other day sleep at 1 a.m. That actually puts everything in a toss. Nowadays, with the mobile phones and laptops, that itself actually has been proven that melatonin in your body goes down dramatically when you're exposed to white light. So you see many phones now come out with blue filters, which actually, when you put it in night mode, the blue light is cut off, which actually doesn't harm the melatonin, which is very, very important. Watch what you eat and drink just before you sleep, and limit the naps which you take in the entire day. Limit your alcohol and absolutely quit smoking. Smoking is an absolute no, but limiting alcohol to less than 2 drinks a day for women or 2 drinks a day for men can actually help lower blood pressure by 4 millimeters of mercury. And you'll say, what is our unit? So it's actually 12 ounces of beer, 5 ounces of wine, and 1.5 ounces of 80 proof % alcohol. That's your whiskey and your rum. Drinking too much alcohol can actually raise blood pressure by several millimeters of mercury. So it is found that people who are not used to even one binge drinking has raised by more than 10 millimeters of mercury, but it actually acts on the systolic pressure. We generally tend to underestimate mental health, and that is something which I just will take a minute on. So relax and reduce stress. Avoid trying to do too much. In today's generation, it's going to be very, very difficult because we are a rat race, and that is actually which has brought us to this point. Avoid stress triggers. Focus on issues which can actually make plans and solve them. practice gratitude. So that will actually come with meditation. I do it myself, and trust me, it really, really helps. Mental well-being will take you a long, long way. Monitor yourself, be aware. Now you have home monitoring tools of blood pressure. Now with COVID, you have saturation monitors, you have wearable devices. Wearable devices actually make a lot of sense. And that actually helps in monitoring what we are doing. Do not avoid medication on any chances. So time and again, we see people that come who have stopped the medications on their own and have come with strokes with pressures of 220 by 110. We asked them why they stopped. They said our blood pressure had become normal, so we thought we don't use. Don't think. Consult a healthcare professional, because that is going to be the key. Ask your healthcare provider how you want to keep monitoring your blood pressure on regular basis, and they can actually now with teleconsultation help you in a big way. Adhere to the medication to their T, because adherence is absolutely the key to a long-term fair being of your health. So there was a trial which actually found that 50% of hypertensive individuals are underdosed and 20% have stopped medications on their own, which is a huge, huge sum. So knowing that you cannot stop on your own is very, very important. And you should, despite the fact that even if you're not hypertensive, you have to go for regular yearly checkups, because you cannot say that I'm 25, I'm 30, I'm 35, I'm 40, nothing can happen to me. You will be amazed at the number of instances of heart attacks we've seen. So the youngest person who I've done an angioplasty on was 20. So you can imagine. When should I visit the ER on emergency basis? Whenever you have shortness of breath, when you have headache, chest pain, blurry vision, when you get palpitations, when you have dizziness, nosebleed, you should absolutely not take any chance and absolutely go to your nearest hospital possible and take care of your health. Thank you so much. We shall be having next lecture series on other heart attacks in younger individuals. Thank you so much for having me.